Initiative for Health Accountability and Transparency welcomes you to CPD Academy's course on Integrated Supportive Supervision, ISS. The CPD Academy is the learning hub for health professionals. My name is Monica Oche. I'll be your instructor for this course on Integrated Supportive Supervision. During the course of this presentation, participants are advised to make their own notes or refer back to the PowerPoint presentation on the lesson materials to download the PowerPoint presentation for this course. Looking at the course design and materials for this course, there will be a graded pre-test quiz at the beginning of the lesson to check the knowledge of our participants and to see how well you're familiar with the subject. Then there is the video which is allowed to play after the pre-test has been completed. There is the downloadable PowerPoint presentation which provides more details on the subject. And then participants will be taking a graded course completion examination quiz after the lessons. We have also made available suggested resources on integrated supportive supervision. And for those who may choose to have course completion certificates or continuing medical education credits, they will need to achieve a 75% pass mark during the course completion examination and also pay a little fee to get the certificates and CME credits. On the presentation outline for this course, we'll be looking at supervision and the types of supervision. We'll also look at who a supervisor is and the qualities that makes a good supervisor. We'll also be looking at the meaning of supportive supervision. We'll also take a look at integrated supportive supervision, its definition, aim, importance, and benefits. We'll also look at the elements of integrated supportive supervision. And then we'll look at activities for supportive supervision to be conducted. Furthermore, on the outline for this presentation, we'll be looking at the differences between supportive supervision and the traditional supervisory role. We'll look at focus areas, tools, and the process involved in supportive supervision. We'll be looking at the planning and conducting of supportive supervision. We'll also look at giving constructive feedback after you have conducted supportive supervision. On completion of this course, participants will be able to explain supervision and describe the types of supervision. Participants would have been able to understand who a supervisor is and the qualities of a good supervisor. They must have understood integrated supportive supervision, its aim, importance, and benefits. Participants should also be able to explain the key elements as well as to describe the activities that are involved in integrated supportive supervision. Also, on completion of this course, participants should know the differences between supportive supervision and traditional supervisory role. They should be able to identify focus areas, tools, and the process for supportive supervision. They should be able to prepare, plan, and conduct supportive supervision on their own. And finally, participants on completion of this course should be able to give constructive feedback after conducting a supportive supervision exercise. By way of introduction, in challenging environments where resources are scarce and priorities are vast and different, it is important to support employees through supervision to make them feel valued, motivated, and more productive at their jobs. Supervision in itself is the act of watching a person or activity and making certain that everything is done correctly and safely. It is a management process through which managers foster and review staff performance based on defined standards. Looking at a healthcare setting, supervision helps build capacity in the healthcare system by allowing you to share workloads with different members of the healthcare team. Effective supervision enables those you supervise to continue to develop their individual competence, receive feedback on performance, and provide safe, quality patient care. Most importantly, supervision instills public confidence in service delivery. Well, let's look at the goals of supervision. What does it aim to achieve? First and foremost, supervision aims to bring about personal and professional growth of employees in order to achieve quality in healthcare system. It is the key to maintain standards as well. Supervision also looks to persist in the delivery of high quality of healthcare services. It also looks to assist and to help in the development of staff to their highest potential, and also to bring about interpreting policies, objectives, and needs of an organization. Supervision also helps to plan services cooperatively and develop coordination to avoid overlapping. Supervision helps to assist in the problem solving of the matters concerning personnel, administrative, and operation of services. Furthermore, supervision also helps to develop standards of services and also the methods of evaluating the personnel and the services they provide. Finally, supervision also helps to evaluate the services given, personnel performance, progress made, and to suggest changes for improving the work effectively and outcome of personnel. Let's take a quick brainstorming session on types of supervision. I need you to take a few moments and note down some of the types or classification of supervision that you know or are conversant with. Though there are various types of supervision which includes traditional, vertical, supportive, integrated and supportive supervision, etc. Each of these types of supervision fall into the following classification depending on the approach. There are two classifications here which includes the controlling supervision and the supportive supervision. Taking a contrast between these two types of supervision, you'd see that controlling supervision focuses on finding faults with individuals, while supportive supervision focuses on improving performance and building relationships. Controlling supervision is a process where the supervisor is like a policeman guarding and watching to see where an employee has gone wrong. While supportive supervision, the supervisor is more or less like a teacher, a coach, or a mentor. In controlling supervision, there is episodic problem solving in the process, while in supportive supervision, there is the use of data to monitor performance and solve problems. In controlling supervision, there is little or no follow-up in the process, while in supportive supervision, there is a regular follow-up in the process of supervision. Controlling supervision is often punitive in actions where people are punished or sanctioned for erring or defaulting from standards, while in supportive supervision, only support is required to be given and corrections made. During the brainstorming session, did you correctly note down and is familiar with any of the types or classification of supervision that has been mentioned? If not, you can refer back to the PowerPoint presentation to gather more knowledge. We've been talking about supervision, but first of all, who is a supervisor who carries out supervision? A supervisor is anyone who oversees and manages a team or individual to ensure that they are performing effectively and are satisfied in their roles. He also monitors and makes sure they comply with rules or other requirements set for them in the discharge of their duties. Here we'll be looking at some of the qualities that make a good supervisor. First, a good supervisor must have the ability to listen, probe, and analyze situations. He should also be able to solve problems and proffer solutions for the problems. He should have an in-depth technical knowledge on the subject matter. He should also have in-depth quality improvement knowledge so as to improve quality. He should be committed to the concept of quality improvement. And he should also have the ability to capacitate, that is, to teach, coach, or mentor. Here we'll be looking at supportive supervision and what it means. Supportive supervision is a process which promotes the sustainable management and efficient use of resources by encouraging communication as well as planning and monitoring results. It is carried out in a respectful and non-authoritarian way with a focus on using supervision as an opportunity to improve knowledge and skills of staffs. Consequently, it is a facilitative approach to supervision that promotes mentorship, joint problem solving, and communication between supervisors and supervisees. I would like to mention that supportive supervision, rather than checking to see what is wrong, is helping to make things work, thereby emphasizing mentoring, joint problem solving, and two-way communication between the supervisor and those who are being supervised. Well, now that we know all about supportive supervision, what does it mean for supportive supervision to be an integrated process? ISS is a process of guiding, supporting, and assisting service providers to carry out their duties and assign tasks in various components of the minimum package of priority health interventions. It is an approach designed to eliminate most of the shortcomings associated with orthodox supervisory processes. I'd like to also mention that it is a harmonized supervisory system which uses a common tool and reporting format based on a collection of indicators from as many initiatives or programs as possible. ISS is driven by a common supervisory team which ensures that managers are in the field on a regular basis, say monthly or quarterly, checking the performance of subordinates and helping them to progressively improve on their competencies. ISS is a key way to achieve results, and by employing supportive supervision, managers can create a healthy work environment as well as improve and sustain the performance and satisfaction of their most valuable assets, which is the people in the organization. And how can they do this? It can be done by using a few key skills and tools with little or no practices. ISS encourages open two-way communication, creating a dynamic relationship with staff and building team approach that facilitate problem solving with their growth. ISS focuses on monitoring performance towards goals, using data for decision making, and of course carrying out regular follow-up with the staffs. It is also conducted by different levels of government and organizations to ensure efficient management of resources and best delivery of healthcare services in healthcare facilities. May I also mention that ISS involves inspecting, controlling, and giving support to health workers to improve their skills and performance, and ultimately quality health service delivery. Now you might be wondering what the importance of ISS is. Why not go through the regular supervisory role and carry out supervision? Now, ISS is important if you're looking to coaching and mentoring individuals or employees to be more productive in the discharge of their duties. It is also an avenue to motivate people at the lower level by way of interaction and sharing information that is made available unto you to be passed on to the other people or your subordinates. It also helps in the assessment of functioning of different systems at facility and other levels. It helps in jointly identifying problems as well as measuring level of implementation of activities in work plans. ISS creates an avenue to measure the quality of services from clients' perspective to jointly improve services. It also helps in maintaining good linkage and communication between levels of the health sector. Here are some of the benefits of ISS. First, you must know that it is more effective than the traditional supervision. It is also result-oriented and result-based. It is beneficial to both the supervisor and the supervisee. We'll be looking at some of the benefits it has to the supervisor. It also reduces the burden of supervision by allowing supervisor more time to devote to other responsibilities. Now here is how ISS reduces this burden of supervision. It does so by making routine low-level problems fewer for the supervisor as staff learn to solve their own problems on their own. It also reduces the burden of supervision by reducing the need for technical assistance to lower-level supervisors as they learn to supervise in a supportive manner. Here is a few tips for a supportive supervisor, what you should know and what you might gain from being a supportive supervisor. You will gain a reputation as a leader, an effective supervisor, and an enabler. You will also be more welcome at sites because you help staff solve their problems rather than criticize them for their faults. You will have the satisfaction of working as a team member, watching your staff learn and grow, and watching quality improve in the process. You also have a fulfilling job as your staff's motivation and commitment increase by the day. ISS consists of 3 core elements when conducting supportive supervision. It consists of a first element, which is an organizational framework with integrated trained supervision teams that report to a coordinating structure. The second element is the supervisory process, with regular ISS visits which are comprehensive, not just the in and outs visits, but very comprehensive and detailed, where you keep to an agreed timetable or schedule. It includes 3 main aspects, where you review key areas, some on-the-job capacity building, discussion of key problems, and agreement on follow-up actions by both sides, that is, the supervisors and the supervisees. The third element of integrated supportive supervision is the review mechanism, which includes feedback to management from the visiting team, a summary visit report and verbal feedback to management and managers, and then a progress or review meeting at least quarterly, of which managers and supervisors are present. Here are some of the activities involved in supportive supervision. First is the setting up of a supportive supervision system. In setting up the supportive supervision system, there are 3 main R's for an effective supportive supervision system to be set up. And the first R is right supervisors, that is, getting right supervisors, a core set of supervisors that are well trained on supportive supervision techniques and with updated information and skills on key issues, that is, areas of supervision. The second R is the right tool. Availability of the right tool or of training materials and job aids to update skills of health workers during supervision visits is very essential. And a checklist for recording recommendations and follow-up is also very important to have. The third R is the right resources. Here we're talking about sufficient vehicles or time allocated for supervision and follow-up must be made available at all times. The second activity for supportive supervision is planning regular supportive supervision visits. Planning regular supportive supervision visits should be an integral part of the annual or quarterly work planning exercise. It is important to look at the data when planning for supportive supervision. And the plan should indicate where to conduct these visits, when to conduct the visits, what are the objectives or to cover during the visits. The third activity in carrying out supportive supervision is conducting a supervisory visit itself. During a supervisory visit to the health facility, the supervisor should conduct the following main steps that are about to be mentioned: collecting information, problem solving and feedback, on-the-job training, and recording the results of supervision. All these steps must be carried out when conducting a supervisory visit. The last activity for supportive supervision is the follow-up activity. Supportive supervision does not end with the conduct visit alone. Back in the office, after the supervision has taken place, The supervisor should plan for follow-up, which may include acting on issues that have been agreed upon, involving health workers in the planning process and working with them to develop checklists or job aids and monitoring tools as the case might be. The supervisor should also discuss equipment supply and delivery problems with higher levels. Furthermore, he must review monthly reports and establish regular communication with supervised staff to see if recommendations are being implemented. And finally, he should identify career growth or leadership opportunities for the personal development of supervised health staff. Now let's take a quick contrast between supportive supervision and the traditional supervisory role. Looking at the area of who performs supervision in the traditional supervision, supervision is designated to internal and external supervisors only, while in supportive supervision, multiple players, including implementing staff themselves, are involved in the supervision process. Looking at the area of where supervision happens, in the traditional supervisory process, supervision is usually a periodic visit and not a routinely or well-scheduled visit. In the supportive supervision, supervision is carried out routinely, and there are team meetings and periodic supervisory visits usually conducted. Looking at what happens during the supervision encounters, traditional supervision has to do with inspection and fault finding, and the focus is on individuals rather than on the processes, and may not take into account other factors that affect an individual's ability to carry out his or her own job. In the traditional supervisory process, the supervisor makes most of the decisions, and they are usually reactive to problem solving by the supervisor. There is little or no feedback from the supervisor. While in the supportive supervision, observation of performance is made and comparison with standard is also carried out. Provision of corrective feedback on performance is also done. Provision of technical updates on guidelines is also carried out. On-site refresher trainings are usually conducted. The use of data to identify opportunities for improvement is also something that is done in the supportive supervision. Joint problem solving and following up on previously identified problems are also carried out. Looking at what happens after supervision encounters. In the traditional supervisory role, the supervisor does no follow-up, or there is an irregular follow-up after supervision. While in the supportive supervision, actions and decisions recorded, joint actions, plan with roles and responsibilities are defined, copies are shared with health facilities and individuals, a routine follow-up is carried out, and ongoing monitoring and support is continuous. Let's take a second brainstorming session. Here we'll be looking at focus areas in supportive supervision. I need you to take a few seconds and note down your keywords or phrases on the focus areas in supportive supervision. There are 6 focus areas in supportive supervision. The first focus area is the area of joint problem identification. Here we are looking to see the supervisors and the supervisee come together to jointly identify problems and to see why improvement has not taken place or why there is poor delivery of quality services. The second focus area is the joint problem solving area. Here, the supervisor and the supervisees come together to jointly identify and proffer solutions to the problems that have been causing impediments in the delivery of services. The third focus area is the training adults area. Here you're talking about on-the-job trainings and giving job aids and guidance during supervision. Another area of focus is time management, where timetables and schedules are being organized in an orderly manner so that services and work can be done cooperatively in an organized manner. Another focus area for supportive supervision is the two-way communication. where the communication between the supervisors and the supervisee are open and both parties understand what the other person is talking about in the area of improvement. Another area of focus is the coaching area, where the supervisor does a lot of work in coaching the supervisees or the people who are being supervised to do the right thing and get it done properly. Now, did you correctly note down the keywords or phrases on the focus areas in supportive supervision? If not, you can refer back to the PowerPoint presentation and download it to get more knowledge. Now we'll be looking at some of the tools for supportive supervision. The first tool here for supportive supervision is the Joint Problem Identification tool, where you're looking to regularly review data and compare outcome and process data with standards to see where there are faults or where there are bottlenecks on why service delivery is at its lowest minimum. Another tool is the Joint Problem Solving tool. Here you are looking to set aims and you are working on quality, the plan, do, study, act circle of quality improvement, and you're also looking at root cause analysis tools. Another tool is the training adults. Here you are looking at training manuals, printing training manuals and textbooks, using handouts and job aids to enhance staff competencies and skills. And lastly, the time management tool is also important for supportive supervision, where you use schedules and timetable in order to avoid overlap of activities. Now let's look at the process for supportive supervision. The first phase of this process is where you have to set expectations, give job descriptions, and set standards. And then the second phase is the monitoring and assessment of performance, where performance gaps are identified and best practices are involved. After the phase, you go on to identifying problems and opportunities faced collectively. And then you can take action and offer support in areas that have issues with improvement. Now let's look at planning a supervisory visit. What do you do when you're planning for a supervisory visit? First, you have to contact the site to schedule the visit. And then you ensure you choose a time that is conducive for the facility. And be sure to describe to them what you'll be doing during the visit and why, which of your staff should be available and on ground, and how you will want them to be involved in the process. You also look at what tools you will use, you explain it to them, and then you also tell them what will happen after the visit and what data sources to be made available for you while you are carrying out the supervisory visit. Also, in planning for your supervisory visit, you have to compile the applicable supportive supervision forms that you'll be needing during the visit, and you have to prepare any training manuals you will need during the visits for those who are being supervised. What to do during the supervisory visits? First, you have to bring to the sites a list of things, and this includes applicable supervision forms, applicable training manuals, applicable data collection tools as well. And during the sites of the visit, you have to be friendly as a supervisor. You have to be cautious and respectful of staff's time. You also help to be a positive and proactive member of the team and be a problem solver to those who are having issues in their areas of expertise. And this problem solving ability of yours doesn't have to be punitive in any way, because it is a visit to help solve problems and not to punish defaulters. Now, before leaving the site of the visit, you'd have to draft a quality improvement plan and share it with the facility manager, as well as meet with the facility head to thank them, inform them of preliminary findings, discuss methods for improvements in data quality, and also discuss suggested next steps to the facility managers. Here we've highlighted some of the preparatory things you would need in conducting supportive supervision. In the preparation stage of conducting supportive supervision, you have to decide where to go, as we have stated earlier. You develop purpose and objective of your visit to the selected facility. You list required materials, that is to say checklists or facility reports, plans, reports of last or previous supervisory visits, etc. And then you also have to decide a time or date that you will be visiting, and also compose teams that will be going for this supervisory visits. You also have to notify the facilities like a week before and remind them much later of your visits. And then you have to draw up a budget and secure the funds necessary to conduct the supervisory visits. Now, at the facility where you're conducting the supervisory visit, you have to make an entry or conduct a brief meeting with the facility managers. You administer the checklist and you institutionalize problem solving. You'll be coaching and mentoring the facility healthcare workers. You wrap up and you do a debriefing to the facility health workers, and then you will go on with the action planning and then do data analysis and report writing, and you give feedback and consequently carry out follow-ups. What you do as a supervisor after the supervisory visit is to fill up all forms that were used in conducting the supervisory visits. You will submit all the filled out forms. You follow up with facility on action plan before next visit, and you also have to plan for a timely follow-up visit to provide training or technical assistance or other identified form of support to the facility. Now, how do you give constructive feedback after you have conducted a supervisory visit? First, you have to listen and observe attentively with an open mind to those who are being supervised. You will provide a positive feedback when performance is good and provide constructive feedback, that is strategies for how to improve when performance can improve. You also have to focus first on the strength areas than the weakness areas of the facility that you are supervising or conducting supportive supervision with or for. Then on those where there are problems, you will now have to tell them where the problems are and focus on areas of improvement. Furthermore, on giving constructive feedback, you have to focus on systems and processes, that is the performance or action, not on the person that is carrying out the process. You have to ask questions as well. Those that you are supervising are likely to have the answers that they need, and they just need you to facilitate in finding them. So they have it within them and they just need you to help them get to the answer. You also have to document areas that need improvement and assist the supervisee to develop their own action plan and timeline. Again, on giving constructive feedback, you always have to review the previous work plan. You have to discuss progress and imagine needs and areas for continued focus. You must be prepared to offer targeted trainings and skill building, technical assistance or mentoring, or to refer a technical lead where it is applicable. Now we'll be taking a conclusion for this course. ISS encourages a collaborative approach to strengthen the health system and to improve the quality of services. It is an effective tool for improving performance. It is a process which promotes the sustainable management and efficient use of resources by encouraging communication as well as planning and monitoring results. ISS promotes mentorship, joint problem solving, and communication between supervisors and supervisees. It is also an approach designed to eliminate most of the shortcomings associated with orthodox supervisory processes. And here we have made available some resources for further reading on integrated supportive supervision. All you have to do is to download the PowerPoint presentation, and at the click of these links, they take you to the landing pages of these resources for further reading and better comprehension of the subject. You can join our CPD Learning Network if you're watching this from YouTube or any other video platform, and ask questions, share ideas, and make comments. And to ask questions, share ideas, and make comments, you can also mail us at iheartnigeria@gmail.com. That brings us to the end of this presentation. Thanks for watching. I hope you enjoyed it and you have improved in your skill as an integrated supportive supervisor. Thank you.